So contraindications of the pills. Some people it's not right for a chemical pill, and sometimes they're not right for a chemical pill. And I say that because there's been people that I've literally had to turn away simply because of their lifestyle. Not that they were doing anything bad or anything that I disagree with or agree with, but because the pill is not what's best for them at that moment. For instance, if you have clients who work outside or who are like in construction or things of that nature, people who do like high intense workout and they're the actual instructor. So contraindications of the pills. Some people it's not right for a chemical pill, and sometimes they're not right for a chemical pill. And I say that because there's been people that I've literally had to turn away simply because of their lifestyle. Not that they were doing anything bad or anything that I disagree with or agree with, but because the pill is not what's best for them at that moment. For instance, if you have clients who work outside or who are like in construction or things of that nature, people who do like high intense workout and they're the actual instructor, they can just not go work out, or who hot yoga instructor, they cannot just not go to work, so sometimes it's just not the right time. Or even clients who are expecting mothers. Okay. So first thing first, you want to make sure that you avoid the sun. Okay. So what that means is, and I know a lot of people think that they're not spending time outside because they're not going to the beach, or they're not spending time outside because they're not, outside playing sports. But even just riding or driving in a car, that is sun. We're in contact with the sun. Okay. So when that happens, even if you just have to drive to a grocery store or to the post office or whatever, make sure you have on a mask, make sure you have on a hat, make sure you have on sunglasses, and make sure that the trip is usually pretty short. No scrubbing. You cannot use anything to exfoliate your skin during the process because you will over exfoliate your skin, which will cause your skin damage. Rubbing your skin. So when you rubbing your skin, you're gonna actually prematurely rub off dead skin that's not ready to be rubbed off yet. Pulling your skin. You cannot pull off your areas that are hanging off. It is not best to pull because then you could accidentally expose areas of the skin that's not yet ready to be exposed, which will cause a hyperpigmentation or a terrible injury to the skin. Waxing is definitely prohibited because waxing opens up the pores too deeply, right? Benzoyl peroxide. You cannot use benzoyl peroxide because it's a dissolving agent. It's essentially a chemical dissolving agent as well. Other exfoliates within the next 72 hours prior to or after pill. No exfoliation at all. Recent cosmetic surgery, laser resurfacing, recent chemical peels or dermabrasions, recent injectables, fillers, Botox, usually not in the same days. Usually for injectables, I never do injectables in a pill at the same time, simply because if you think about it, whenever you are injecting with Botox or fillers or whatever PRP, you are causing a hole inside of the skin tissue. It may be a tiny hole where you can't see it. However, if you put a chemical peel on top of that, you are basically putting the peel deep into the skin in areas where the peel is not supposed to be, because chemical agents are not supposed to be injected into the muscle, right? And so that's what you're doing. You're injecting using vitamin A products such as retinol, retinase, and etc. Because retinols, retinase, Accutane, those type of things are dissolving agents already. You're going to over exfoliate again. Allergies or sensitivity to products and ingredients, pregnancy, lactation. There's no studies that exist where a pregnant individual or lactating individual receive certain cosmetic procedures. That's why it's a contraindication, because it's a risk that providers and the mothers are not willing to take it. At that point, it's just not worth the risk. So there's no studies or education behind it. You just don't do it. Active herpes, inflamed rosacea, infectious disease, open sores are suspicious of lesions, sunburns, irritated skin, including dermatitis or eczema on the area, chemotherapy or radiation within a year. And I say that because chemotherapy and radiation changes the makeup of the skin completely. It depletes certain vitamins, it depletes certain hormones. It makes the skin so much more sensitive and thin that the client simply cannot tolerate even something such as an enzyme pill. Reactions to salicylic, which has like aspirin and things that has aspirin in there, are photosynthesizing medications like antibiotics or such. And all of these contraindications are in place because either there was a study where a reaction happened, or there's no study and we don't want that to happen, right? And so it's very important to make sure that you know about your client's health history, that your clinician knows about your health history, that you also make sure that you talk about, like, is there a chance that you could be pregnant, or, just talking about those personal things, and talking about what your client do. Like, I'm not being invasive, but what do you do for a living? I need to know, are you a gardener? Are you a lawn care person? Are you a construction worker? Like, is this a good time for you? Are you a hot yoga instructor? Because then that's going to interfere with your work. If I do this chemical pill, is there another time that we can do this pill, right? So contraindications are in place for safety. So I hope we're doing okay. I know this is a lot of information. However, it's a lot of good information, and I want to give this information because it's a lot of things on social media where a lot of things could have been prevented with simple education between the client and the clinician, or just the clinician who needs to be educated on this process. So let's talk about skin preparation, how to reduce adverse reactions and complications. Okay. So again, I'm gonna let you guys play these videos on your own. But please pay attention to these videos because I feel like a lot of this could have been, 100% of this could have been prevented if the clinician was educated and the client was educated, because somewhere along the lines, these adverse happened because of a lack of education on someone's part, okay? These are really great videos, and you don't want none of this to happen to your client or your client to feel any of this. So skin prep, reducing complications is the key. I cannot stress that enough. Reducing complications is the key when it comes to advanced treatments, right? So I say prepare the skin for a minimum of 2 weeks. The best preparation is 4 weeks, okay? Prepare the skin. If you are a professional, I do have a class that goes into detail on how to prepare the skin, but to just sum it up is to make sure that your client has the home care that will be effective to receive the chemical pill. So send your clients home with a skincare kit that will not react or interact with the pill, okay? And then also making sure you do either a patch test or a lighter pill or enzyme pill in between that time, okay? And then having a true skincare routine. I just said that. Making sure your clients have professional products that will not intervene with the chemical pill. Do an advanced treatment prior to the pill. What I mean by advanced treatment, do a dermaplane, do an enzyme pill, do a sensitive pill. Do those things prior to the actual pill, because you want to see how resilient the skin is. If the skin can tolerate going farther, you don't want to just jump into something and the skin is not prepared or ready for it, right? The best results are seen in a series of 3 or more due to the superficial or the deep pigmentation, wrinkles, or just problems in general. Okay, so be honest with your client. Say, look, I know that I will make a great difference in your skin, but it will not just come from one treatment. One treatment will make a difference, but it will not give you the best and a long lasting difference. I want your difference. I want you to be happy with your treatment. I want your treatment to go well, and I want you to have long lasting results. You have to be honest with them and let your clients know that one treatment just don't fix things. You know, sometimes it takes multiple treatments. Sometimes it takes more than three, but usually 3 to 4, maybe 5. I've never had to do no more than 5. But you know, there are some skin that's a little bit more resilient than others. Caution about stack treatments. I think this is another place where things go wrong. A lot of times clients want the best results, and the clinician is like, yeah, we can do this and that. We can do a microdermabrasion in a chemical peel, or we can do a dermaplane in a chemical peel in the same treatment, which is true. We 100% really can. But is your client's skin prepared for both of those treatments? Is the stack treatment that you're trying to do, is that treatment beneficial to your client, or is your client going to react? So just be cautious about it. This is where education and a deep conversation come in to make sure that this client is ready for the stack treatment. And let me start at the beginning, because a lot of people don't know what a stack treatment is. So stack treatment is simply where you're doing two treatments in one. So that will be a hydrodermabrasion, a microdermabrasion, a dermaplane, or something of that sort. That's what I consider a stack treatment. And then on top of that, you will do a chemical peel. And essentially, what it's doing is literally over exfoliating the skin, or preparing the skin to receive the peel and allow the peel to penetrate deeper. But the client's skin has to be prepared to do that stack treatment. If I go back on one of these pictures right here, if you click on that and watch that that video, this client had received a stack treatment. This client received a chemical peel. I think first she received a dermaplane, a microdermabrasion, and then the chemical peel. So that was like a lot of exfoliation. So, or maybe, and there's another video out there where a lady received a microneedling and received a chemical peel, which is, those are stack treatments that I don't think is best for anybody. So what to expect of a chemical peel? So most importantly, like I said before, make sure that your skin is prepared, your client's skin is prepared, they're well educated. This is a constant education moment for you and for your client. You're constantly talking about this. You're constantly reminding them, checking up on them. Hey, how's your skincare routine going? Are you having any purges? Are you having a reaction, and things of that nature? Because you want to make sure that your client is preparing himself for this pill. Okay. So again, here's some other videos. This video right here with the girl with the braids, I really liked it because I don't think that her clinician explained to her what a chemical peel was, how a chemical peel will feel, how to best care for it. I think that here, when I watched this video, to me, it looks like her peel was doing exactly what it was intended to do, but she just didn't like how it was itchy. Her skin was feeling tight, and things that we should be telling our clients exactly what they're going to be experiencing. The second video with the girl pulling her skin, she don't have a lot of she's pulling a lot of skin off is what she's doing. That is a huge no. You cannot peel skin, because remember, again, the skin underneath may not be ready to be exposed to environmental exposures. The lady on the end looks like a clinician is probably pulling the pill for her. She's a client who has a lot of pigmentation, skin of color. And so I would not advise anyone to peel a pill for a client. It's just not recommended. That's, again, going back to the skin underneath may not be prepared for the exposure. What to expect? So Go over the do's and the don'ts. It's so important to go over the do's and the don'ts with your client. Make sure you're sending your client home, even though they have the skincare kit at home, making sure they have aftercare kit, making sure that they have written instructions. And what I like to do to decrease the confusion, and I know it's a lot of information for clients, it's a lot of information for the clinicians, and sometimes you don't have an extra 20 minutes to spend in providing education. So I give my clients a digital ebook that they will receive, and that will allow them to reference back to the book. And then I have a, if anything other than what's on this page happens, call me. So yeah. So number one, do not peel the skin. Do not peel the skin. Okay. Always have an antidote when applying a peel. Make sure that your clinician or you as a clinician have a neutralizing agent at the table side. You don't want your client to be having a reaction. Then you have to scramble to find neutralizing agents. You don't want that to happen. You want to already have everything you need at the bedside, at the table side to perform the treatment. And just in case, the safety mechanisms, just in case the treatment is not going as planned. The time you spend rushing, trying to figure out, oh my gosh, how do I neutralize this pill? You got to research it. You got to find the manufacturer's information. You have to read through it. You have to gather the supplies if you have the supplies in the office, and it creates a terrible experience for the client. And then you're panicking, the client's panicking, and things don't go as well. So do use the pain scale between each layer. I cannot stress how important it is to make sure when you're layering, especially when it comes to the client's skin or color. I usually go over more in detail about how to layer the actual treatment to prevent burns in my more advanced class. And it's only for professionals. But making sure that you use the pain scale. So as I'm applying each layer to the skin for my clients, I'm saying, okay, this is the first layer. On a scale 1 through 5, with 5 being the most intense and 1 being mild, and we can move forward to another level. Let me know what your intensity level is. And I'll say, oh, it's a 2 or 3. If it's a 3 or 4, I don't go forward. What I will do is I will just let the peel dry. So we have the fans going. The client usually have a fan like around their neck, and then I have a fan in there over their face, just fanning it, letting the peel dry. And then I'll ask again, hey, what's your intensity level now? And they'll say, oh, it's a 1 or a 2. So I'll move forward with the second layer, and we'll constantly do that until we're satisfied our per the protocol of layers the manufacturer warrants. Okay, do not overlay layers. And what that means is, say for instance, if I was doing a chemical peel right here on my arm, or let's say on my hand. So when I'm doing chemical peel and then I have my gauze or whatever you use to apply the chemical peel, overlaying means simply putting a peel on in one area. I see this often on social media, and I think that that's also where a lot of problems come into hand, because you're overexfoliating the area and you're putting more layers, you're putting more acid in that one area. So when I lay peels 1 layer at a time. Here's 1 layer going all the way across, and slowly I'm moving over the back of my hand. If I'm overlaying, then that's when I'm doing my pain scale. And then I'll do my second layer, go over. And then when people overlay, they're simply, and they're going back and forth. You don't know how many layers you just put on. So, and that can cause a burn, and some areas can be more intense than others. Some areas can peel deeper than others. And then you get this overall experience after the peel that you don't have that good complexion that you were looking for, because some areas peeled a little bit more. You get the hyper and the hypopigmentation. Excessive erythema. So These are areas where you know to stop. So even with clients' skin of color who have darker pigmentation skin, their skin will start to turn red, or their skin will begin to frost, or their skin will begin to blanch. That's when you know I cannot apply any more chemical in that area, right? That's where you get the overlaying. You need to watch, and that's why I like to assess my clients in between each layer so I can take a look at the overall skin to be sure that I'm not getting frosting. When you start getting frosting, that means the skin is done receiving that peel. If you go any farther, you're going to cause hyper or hypopigmentation. The same thing for erythema. Don't do it. These, I put these up because I really love these two clips. The girl with the scissors, she did a really good job. A lot of clients, who has the urgency to peel the skin, I say don't peel the skin. If you must do anything, cut the skin, the dead skin off with clean, sterile scissors. But don't cut anything extra. And so she did a really good job on demonstrating how to do that. It's another girl who talks about how she received a chemical peel. She went to her esthetician 3 months and received three consecutive months and received 3 chemical peels. And it showed a huge change in her acne, in her complexion, and overall just beauty. So some things that I always tell my clients, what to expect, and this is pretty much for any peel. Let's go back here. So this is pretty much from any peel. So what I tell my clients what to expect. So I will say the day of the treatment on to day 5. So how will the skin appear? The skin will appear tight, itchy. It will look moist and dewy, and then have like a color tone. A lot of peels have like a yellow or orange tinge, or sometimes a red tinge to it. The following morning afterwards, your skin will feel very tight and dry. By day 2, you may start to peel. By day 2 through 5 is usually around 3 or 4. You get the heaviest peeling, and by day 6, the peeling is usually a lot slower. Precautions. So each day has special precautions, and basically it's like, do not peel. Make sure you're doing aftercare. Make sure that you are not increasing the heat. And so what that means is, like, for my clients who work out very heavily, I don't want you working out for the first week. I don't want you going into a sauna. I don't want you just even standing over the stove or opening up the oven, because that heat will exacerbate and push the chemical peel deeper into the skin. So those are things that you have to think about and talk about with the clients. So deeper dive. So if you guys have questions, please put them in the comments. I would love to go back